Hello everyone, so this is part 2 of the orthodontic terms series, and you can find part 1 through this link or in the description. So these videos will get you familiar with common orthodontic terms. So let's start. So the first term we will discuss today is crossbite, and we have two main types of crossbites. Anterior crossbite, where the lower teeth are in front of the upper teeth, like in class 3 cases for example, or a posterior crossbite, where the upper posterior teeth bite inside the lower teeth. So for example, in a normal bite, the upper buccal cusps are usually labial and do not directly occlude with the lower teeth. However, in a posterior crossbite, they could bite on the central fossa of the lower, and this is usually seen when the maxillary arch is narrow and constricted. So it is mainly a transverse problem, while the anterior crossbite is mainly an anteroposterior problem. Another type of crossbite is the scissors bite, and this is kind of the opposite of a posterior crossbite, where the upper posterior teeth are positioned buccally excessively, and this is sometimes called Brodie's bite. The second term for today is graft modification. So graft modification means that we can modify or alter the growth pattern of a patient to correct a skeletal problem, usually using extraoral appliances like a headgear or a face mask. And this type of treatment, of course, can only be used with growing patients. And we will discuss this in details in coming videos. The next term is camouflage treatment. So camouflage generally means hide or disguise the presence of something. And camouflage treatment is usually used to treat mild to moderate skeletal problems to avoid surgery. Let's have an example. Imagine we have a class 3 in an adult patient, and after analyzing his lateral cephalmatic X-ray, it was found that he had a protruded mandible. Of course, the mandible itself can only be corrected or repositioned with orthodontic surgery. But since the jaw discrepancy is not severe and can be camouflaged, we can instead just extract lower first premolars, for example, and retract his teeth to just camouflage or hide the problem. This could be one way to solve the problem. But just note that there could be several ways to correct the same problem, each with its pros and cons. That was all for today. If you enjoyed this video, give it a like and subscribe to the channel for more coming videos.